Racial and ethnic minorities are underrepresented in clinical trials in the United States despite decades of efforts to improve the situation. Under the direction of Congress, the FDA developed a plan to increase diversity and have made it a priority, exploring innovative approaches to engage minority populations in clinical trials and invite sponsors to support these efforts. HEAL proposes to engage African Americans in clinical trials by supporting the health of local church congregations. Julius Spears explains.
I think we've become more educated, especially the caregivers. So at this juncture, people know that they're buying medications off the shelf. They really don't know whether or not the medications will work, won't work. They're just following the lead of their physicians, which is good, which is what they ought to be doing. But the reality is there's becoming more of a concern as to, specifically among African Americans, whether or not medications that are out there are really going to be working for us. Unfortunately, a lot of the strategies that have been out there haven't worked. You know, one of the major strategies is talk to doctors. If we can get the doctors will get their patients. Doesn't work that way. A lot of these doctors, first of all, you got to educate them, but a lot of the doctors find it difficult. And with the payer systems the way they are now, doctors are focused on how many patients do I need to see, as opposed to do I take 45 minutes with this one patient and try to educate that patient with family members as to what ought to be done. I was in D.C. Attending the National Black Caucus's annual conference, and I took the time to meet with a pastor who has a sizable congregation. So I asked him, I said, well, how many members of your congregation are obese or overweight? He says, I don't know. I said, well, how many are hypertensive? I don't know. I said, how many are diabetic? I don't know. And I went on with a couple of diseases, and he says, okay, I get your point. So what am I going to do about it? I said, that's my question to you. What are you going to do about it? We want to help you develop that profile of your congregation. We want to come in, we'll do a survey of your congregation. We want to be able to come back and talk to your diabetic patients. We want to be able to come back and talk to your obese patients, talk to your hypertensive patients, and offer them some education in terms of, there are studies out there dealing with your specific illness that, frankly, we think you could possibly benefit for participating in the study. But we want to educate them. I mean, he was like, how soon can you do it? Do I need to schedule something? Can you do it at one of my Sunday services? All the churches I've talked to, the ministers are eager to participate, starting with that little simple concept of what does your congregation look like? What's the profile of your congregation? So all we need to do is educate them about what we do. I've been CEO in a number of hospitals, and in each facility, we've tried to introduce clinical research, and thankfully, we've been successful at doing that. If you do clinical research the right way, you end up making a difference in terms of the patients that you're servicing. You're offering them something that previously hadn't been offered before.